Serious, people who have had a serious disease, cancer, MS, organ failure, etc. When did you realize something was really wrong? I had been having a lot of pain in my midsection, and all around my torso for several weeks. I went to the doctor and it was dismissed as gynecological cramping, menopausal. It remained. After several weeks, 6 to 8, I couldn't take it anymore. I went to emergency in the middle of the night. I got a CT scan that showed a large kidney stone. They also found a mass on my ovary. The kidney stone led them to finding a rare ovarian cancer. If not for that stone, I wouldn't have known about the cancer and might not have caught it in time. I have been in remission since September 2021. I couldn't walk anymore with my crutch I had been using to get by. Had been on Percocet for 8 months because of the extreme pain. Nobody was finding answers to my pain, but I knew something was wrong, badly. After finally having an ultrasound on my hips at the age of 26, I found out I had to undergo a double hip replacement to walk again due to a serious rare disease. I was stage 4 avascular necrosis. Took a year to recover from both. But happier ending, I'm doing good now. However, it was very upsetting news to get over a phone call at 26. I never did, my teacher and parents did. I was 7, usually an active kid, and my first grade teacher noticed that rather than running around at recess I sat down and took a nap. It happened a couple more times, and after I fell asleep in class, totally out of character, she gave my parents a call. We had been visiting the doc fairly regularly cause I was also complaining of joint pain and frequent ear infections combined with the new symptoms and a new doc at the practice. I was finally diagnosed with leukemia. Wasn't me but my sister. She lost a decent amount of weight in a short period of time and began sleeping a lot more and just being tired in general. After that came the hair thinning and pain in the joints. She was diagnosed with a cluster of autoimmune diseases affecting different parts of her body. At first the doctors would call it a connective tissues disorder. Cause of death on her certificate was multi-system organ failure. Worst few months of my life. I can only imagine how much she was suffering. I was diagnosed with MS when I was 22 after having blurred vision in one eye after a ski trip. I went to the optometrist and they said I had a dry eye, probably from not wearing goggles while snowboarding. So they gave me steroid drops. After a week it kept getting worse, so I went back and they told me my eye looked much better, so they did a field of view test, which showed I couldn't see anything out of the lower half of one eye. They sent me straight to the emergency room since nothing was physically wrong with my eye. They did some tests and I was diagnosed with MS and ended up going completely blind in one eye. My vision eventually came back and I got on medication within a month, so haven't really had any symptoms or issues since, thankfully. I'm only 29 now though. My kid, who was 14 at the time, kept throwing up in the morning and having weird headaches. Her doctor thought it was migraines. She went back a couple of times, but the doctor was not concerned. Then one day she complained of a whooshing noise in her ear. Went to the children's hospital and found out it was a brain tumor near her cerebellum. She was in ICU for a month, but turned out it was non-cancerous and it never grew back. She is doing great now. I started feeling small, sharp twinges of pain in my right breast. The skin texture under the nipple changed and looked like an orange peel texture. My primary care doctor told me it was mastitis. He didn't even feel for lumps until I asked him to. He prescribed naproxen for the pain and had me get a mammogram. It was stage 3 ductal breast cancer. I had a mastectomy in 2020. Got chemo and radiation. I'm doing well now. WTF, orange peel texture is like one of the most alarming warning signs. I can't believe that doctor brushed you off like that. I mean, I can, doc, but geez. Glad you're well. I started jogging again to try and get back into running shape. I kept noticing that just after a mile or so, I'd stop and get really lightheaded. Kept thinking, oh, I'm really out of shape, and kept going. Went in a few weeks later for my annual physical and doctor said, you ever been told you have a heart murmur? No. 2 months later I spent Christmas of 2017 in the ICU after having a section of my aorta cut out and a new valve put in. Surgeon said it was bad. Said it wouldn't have made it too much longer. Edit, for clarification, it was an aortic dissection. My mom's story. We moved a lot when I was young. Dad was in the military. Last stop was in NJ, 1980. Through the 80s my mother's coordination and sense of balance slowly got worse and worse. She joked that she was probably just allergic to NJ. It got bad enough that in 1986 we addressed this with the doctor. They tested for inner ear infections and a host of other things it could have been. Thought it might have been mercury poisoning from her fillings, so she had them all replaced. Finally, in the summer of 1988 they did the spinal tap and found out she had MS. Chronic progressive MS to boot. By 1990 she gave up driving. By the mid-1990s she was wheelchair, scooter bound. Fast forward to the late 2010s after other serious health issues. Not germane here, and all of a sudden she starts losing weight. By this time she has a host of doctors looking at her different issues. They assume one of her issues or the other is the problem. Finally in late 2017 she has her colonoscopy and they found it. A stage 4 cancerous tumor. We did our best to make her last year and a half as comfortable and fulfilling as we could. We did things for her to make sure her last days were filled with as many good memories as possible. But it did its thing and we said goodbye on February 2, 2019. I guess the big thing is, sudden changes should never ever be ignored. I don't know if my gallbladder F-up is actual organ failure, but it did fail to function enough that they decided to take it out. Eventually, I was naked on the toilet and passed out from the pain and struck my head on the countertop on my way down. I woke up with my head spinning and I was telling myself not to poop anymore because I'm home alone and not on the toilet anymore. Then when I really did come to, I pulled myself out of the bathroom, got dressed, and into my car and went to the air. There I was told that I'd tested positive for marijuana, so that's why I hit my head. I was too goddamn high to even stay upright on the toilet, apparently. I left there and drove 30 miles north to a town of 14,000 people and took myself to that air. They gave me a sonogram, CAT scan and finally a test called HEDA scan. The HEDA scan showed my gallbladder was only emptying at 8% and the surgery recommendation was 32% or less. They took it out the next day. Does appendicitis count? I was home for summer break when I was 19 and noticed an unusual aching pain in my abdomen. It wasn't bad at first, but when it was still hurting and getting worse the next day, I told my parents that I thought I had appendicitis. My dad, a doctor, snuck me in the back door of his private practice and gave me a CT scan, which looked inconclusive at the time, so we decided to wait just a bit longer. The next day I was definitely in real pain, so we went straight to the actual hospital this time and got some more tests. They were still a little inconclusive, but apparently my dad noticed that some swelling was worse than it was the day before and convinced the doctors to operate. Sure enough, my appendix was infected and needed to come out, but we caught it so early that I was up and about in a couple of days and barely have a scar. It's great that your dad was there to advocate for you and happy to hear of your recovery. It's insane how this thread has so many stories of medical professionals not listening to their patients, especially female patients. I'm all for finding a professional that listens to you and reporting the ones that didn't. It was similar for my appendicitis too. I was a teenager and my mom was out at a concert. It started out just with nausea, so I had some crackers and Sprite to try and settle my stomach, but it just kept getting worse. By the time she got home I was doubled over in pain and overheating. She called NurseLink, phone line, to speak to a nurse, who told her to bring me to the hospital. By the time we got there, I was vomiting like crazy. They ran a few tests, found out my appendix was swollen, and I had it removed the following day. I was discharged from the hospital the day after that and only have a couple small scars to show from the whole ordeal. Literally not until I went to the ER for persistent abdominal pain, thought it was a bad hernia, and got a CT scan that showed stage 4 colon cancer. I even worked that day and drove myself to the hospital because I figured I'd be back home in a few hours. To me, that's the scariest part about some of these cancers. The symptoms don't get to, dude, this is fucked, level until you need emergency surgery and drastic measures. Best advice I can give while is to get a general practitioner and go in for regular checkups. Your body may not throw up red flags until things are really, really serious. Lost an ovary to ovarian cyst torsion. It's a completely treatable condition if it's diagnosed in time. Fatal if it isn't. Went to 2 hospitals over the course of 5 days for the pain, and got the brush off until the 3rd visit when they rushed me into emergency surgery. This piece about how the healthcare system ignores women's pain is written by the husband of a woman who had the same condition I had. Basically, I was minus a husband to advocate when the staff didn't recognize an emergency as an emergency. It is sadly common for medical bias to do this to women. A few useful LPTs. According to my gynecologist, one of the ways ovarian cyst torsion feels different from appendicitis is when you lie in different positions, such as turning from your back to your side. The severity of the pain may change. Either is a medical emergency. But when it's the right ovary, the pain is in a similar location. And yeah, this is 10 pain on the 1 to 10 scale. If you're a woman heading into the or urgent care with those symptoms, insist on an ultrasound. That's the standard diagnostic test. I have 11 staples in my abdomen because all of half a dozen medical doctors were too biased to bother running that test. By the time they finally ran it, my ovary was dead and in danger of bursting. If you're a woman in the or urgent care under these circumstances and you're still getting the brush off after specifically requesting an ultrasound, then start a paper trail. If you haven't been given a room, then insist the triage nurse state a reason in your record why you've been deprioritized. If the physician doesn't think an ultrasound is necessary, then insist the doc write in your record that he is refusing your request for an ultrasound. Get out your phone and start taking your own notes. Look up a malpractice attorney. This is one situation where extreme measures are called for, and the fear of a lawsuit is more likely to get the appropriate action than losing your temper, because if you make a scene they may misinterpret your problem as psychiatric. To the gentleman reading this, I understand every kick to the groin in history. My gonad went through 3 complete rotations before it died. If you feel sick, do not just randomly go to the doctor. Take notes. Document your illness. Saying your tummy hurt 3 months ago should get you sent away. Chronic documented issues get fixes found. Good data gives good results. People find trends in data presented to them usually. This is so true. I brought along a timeline of symptoms and things other doctors already tried, for a disease that many people take months to years to diagnose, and I got diagnosed practically on the spot. I was having a hard time walking, which was unusual because nothing really changed from my routine. And I wasn't exactly in any sports, but I was still limping and it was painful to walk. Turns out I had juvenile rheumatoid arthritis and my ankle muscles were swelling. My fingers were also weirdly shaped because of the swelling, almost looking deformed. 5 months later, I was diagnosed with lupus and started chemo the year after. I was 13 turning 14. It'll be 11 years since diagnosis this month. There is still no cure. Does rhabdomyolysis count? I accidentally gave it to myself and it sure would have been fatal if I had not gone to the hospital. I have been an athlete on and off more my entire life, so I am very familiar with what my muscles should and shouldn't feel like. I woke up the day after my first heavy workout in years, bad idea, and immediately knew something wasn't right. My muscles were so sore I couldn't straighten my arms. I was stuck in T-Rex arms. Even if I stretched them, I could literally watch as they tightened back up within a minute back to their original locked position. After calling a few doctors, they recommended I go to the emergency room as a precaution. Took them a few hours to diagnose it since I wasn't in visible pain, had light-colored urine, and rhabdo is pretty rare, exceedingly so for people just going to the gym. It was my partner. It turns out she has Crohn's disease and had to have a section of intestines removed because it had deteriorated. This was after 3 months of getting the run around at the hospital. She started getting sick. She couldn't keep food down and had a lot of pain in the lower abdomen. Her doc thought it was a UTI. When it didn't get better, he sent her to the hospital for scans. I didn't know it, but she told the hospital we have no insurance. My employer had just switched us to a high deductible, which means we pay the first $5,000 out of pocket, before the insurance pays anything. In her mind, we weren't using the insurance since we had to pay 100% anyhow. 3 months of going to the emergency room and getting turned away because she said we have big insurance. Once I found out what was going on, the hospital sent her to a specialist who found an abscess by using a sonogram. From there she immediately went to the hospital for emergency surgery the next day. The specialist said she might not have made it another week. FYI, I also have crappy insurance with a $9,000 deductible. You can dispute charges with the hospital and get the bill reduced. They will ask for proof of income, like 3 months' worth of pay stubs, and proof of expenses, like utility bill, cell, insurance, internet, whatever you spend to live life, and let you know if you qualify for hardship billing. I've had a visit reduced by 75% before. Plus, you can pay the hospital's bills slowly on a monthly basis so it won't bankrupt you. I don't think they can charge interest if you don't pay all at once, like your credit card would do. I was diagnosed with 2 types of thyroid cancer. I had a goiter for years but was told unless I had trouble breathing, swallowing, or voice changes it was just cosmetic. I would get ultrasounds and checkups every few years to make sure it was all okay. Right before COVID hit, there were really bad wildfires in California. I had a really hard time catching my breath. I chalked it up to the poor air quality. I was really tired all the time with zero energy and body aches. Then, I started having trouble swallowing. I would choke no matter how small of a bite. It would feel like there is food stuck in my throat. I got an ultrasound and biopsy and everything looked normal. This time I insisted that they remove the goiter even if it's just cosmetic. I didn't get an appointment until November, this was around April, so peak COVID. When I finally went in for surgery, the ENT surgeon decided to just remove the part of the thyroid that had the goiter because I was young and no skewed lab values. With the follow-up appointment about 4 days later, I was told the pathology report showed cancer. I was quickly scheduled to remove the other side of the thyroid. That pathology report came back as a different type of cancer. 2 types of cancer in the same organ. I am so glad I insisted on having the cosmetic surgery. God knows how long I was dealing with cancer. All the weird aches and pains, fatigue, and depression were just signs my body was fighting something insidious. Listen to your gut, people. Get a second opinion if needed. One day I woke up and for the whole day I had this weird sensation like I was floating a few inches off the ground wherever I went. Next day my vision was a little blurry. Third day my vision was way blurry, I was seeing everything in double, and now I had vertigo, like the room was spinning. I got the runaround with my insurance, had to wait 2 more days to afford seeing a doctor. By day 5 we started chasing what would later find to be a red herring, possible diagnosis of myasthenia gravis, an autoimmune disease of the junction between nerves and muscles. By day 10, I'm starting to develop paralysis of the muscles in my eyes and face. Those blood tests came back negative for any relevant autoantibodies, so I went to got an MRI. Demyelination occurring in my brainstem, causing loss of signal in several cranial nerves. And incidentally several other locations that had previously demyelinated without me noticing any symptoms. So that's how I learned I have multiple sclerosis, the autoimmune disease of the myelin sheath insulating cells in the central nervous system. Weirdest part was that after a heroic dose of corticosteroids, most of the brainstem myelin grew back and I no longer have those symptoms. Maybe not quite as serious as all these others, but my mother died when I was 7 from an unknown to her heart condition that just stopped her heart. She'd had symptoms for years, lightheadedness, dizziness, fainting, etc., but they were never bad or frequent enough for her to get worried about. About a year or so after she died, I passed out and we immediately went to the hospital because of my newly discovered medical history. Turns out I've got the gene that can develop into the same condition and I've been monitored yearly ever since. So I technically haven't officially gotten it yet, but if it weren't for what happened to my mom, there's a good chance we would have ignored all the symptoms that have popped up because they've been so infrequent and it's such an uncommon condition for anyone under 60, so I might have ended up like her. I noticed some severe pain in my testicle one day walking to class. I thought nothing of it, and figured I had just bumped on something the night before. I ignored it for a couple of days until one day in class one couldn't sit correctly, my groin felt cramped and I had to constantly shift in my seat. I went to the bathroom and thought I might take a look and noticed that my left testicle had swollen to roughly 3 times the size of my right, and started to become concerned. I finally went to the doctor the next day to see if it was serious or not. They checked me and quickly referred me to another doctor who told me that I need to get my testicle removed immediately, and the next day I had surgery. Turns out I had stage 2 testicular cancer that had spread to the lymph nodes in my abdomen. I ended up getting 4 rounds of chemo, followed up by an RPLND, retroperitoneal lymph node dissection. I'm really glad I went to the doctor before it got worse. This isn't me, but this happened to my best friend very recently. Like in the last couple of months. Was perfectly fine and healthy one day. Then the next he started feeling a little bit of pain in his kidney. He'd had kidney stones before, so he figured it was that again. Then he started peeing blood. He thought it was still part of the kidney stone thing, so let it go for a couple days, but he was still peeing blood and the pain was getting worse. That's when he decided to go to the doctor. They did an X-ray and found a mass in his kidney and told him that based on where it was located they can't remove the mass, and they can't do a partial kidney removal, and it's about a 90% chance it's cancerous, but they wouldn't be able to do a biopsy without removing the kidney first. They did the whole insurance dance, but it went fast and within 2 weeks he was in surgery having his kidney removed. He's still recovering at home right now, but they got the biopsy results last week. It was indeed cancerous, but they caught it before it spread. People might not think it's that serious, but before I was diagnosed with diabetes, I was in hell. Everything I ate, it was like it wasn't doing anything for me. I was confused all of the time, especially after eating, and I was constantly having to pee and constantly drinking water. We are talking 4 gallons of water drank a day with me having to pee sometimes twice an hour. I learned I had diabetes thanks to a car accident. My fasting blood sugar was over 350. After they put me on my meds, it was night and day for me. I had a week of feeling blare, then it was back to normal for me. Breast cancer here. I'd been feeling off for a couple years. Anxiety, depression, feeling something was wrong, just got worse and worse. One day I found a lump while getting ready for bed. My boob had been feeling active almost like when I was breastfeeding. Feeling letdown sensations and clogged milk duct sensations. I also had a dimple over the tumor site. I knew it was bad news at my ultrasound. The doctor came in after the initial pictures and did another ultrasound herself, then told me to come back for a biopsy. My tumor was BIRADS5. So basically highly suggestive of malignancy. The feeling that something was wrong went away when I got my diagnosis. I felt a large amount of relief that we figured out what was wrong in time. We caught it early and I'm almost done active treatment. Surgery, chemo and radiation. About halfway through radiation right now. The first clue was that everything hurt, all the time. I started self-medicating with legal, non-prescription drugs. It didn't work, but it was enough that I could kinda keep going to uni. The second clue was when I started sleeping 18+ hours a day. That was an issue. I basically stopped functioning. I don't remember much from those months. I have records of things I did, but I don't remember doing them. I apparently took and passed a physics class. I also ordered a 3D printer, ran 2 D&D campaigns, and watched about 300 hours of Netflix. After about a year of that, my parents said, "You're not functioning, we need to find a diagnosis and treat it." I was so out of it that I couldn't muster the impetus to find a new doctor after I cursed out my current GP, who was legitimately an idiot. They insisted. We went to the Mayo Clinic, got a diagnosis, and started investigating treatment options. Unfortunately, fibromyalgia has no cure. It's barely treatable. The autoimmune diseases are treatable, and those medications kinda work. My memory and cognitive functions are still severely impaired and I'm in moderate to high pain on a daily basis, but I'm able to do about 2 or 3 hours of light to moderate exercise every day. Believe it or not, that's a huge step up from where we started. If you're concerned, find an actual doctor and have them start running tests. My experience taught me that the Mayo Clinic is staffed by competent and educated doctors. The wait times are atrocious and the cost is not trivial, but they're good at their jobs. That's my default suggestion, because they will find the answer. It might take a couple months, but they'll get it done. I'm currently 28, happened last summer. Lower back pain that didn't go away or get better for a few weeks in July and was referred to physical therapy for sciatica. Then a few weeks later, left testicle felt off firm last August for 3 days and I made an appointment with my primary care to get it checked. Nothing else too out of the ordinary. Went to the doctor in the morning thinking I was just being cautious and would be all set. Had an ultrasound and by that afternoon was given greater than 90% chance of it being testicular cancer. After surgery, CT scan showed that it had metastasized to lymph nodes, masses in my abdomen, pressing on my pancreas, aorta, kidneys etc., spine, causing the back pain, and I had another mass in my upper chest. Did chemo, and during chemo I ended up having a pulmonary embolism, blood clot that went into my right lung, that I only noticed because I was short of breath and had some slight pain when laying down resting after my infusions for the day. If you're curious, I have some of my comments, post history documenting that and how it's been going, but I finished chemo at the end of November, have recovered from the pulmonary embolism, am in remission and back to living life and wasting time on Reddit. I lost feeling in my hands and feet from the chemo, but that has largely stated to come back now. For all the testicle having folks out there or who are close with someone who does have testicles, do your monthly checks. It's quick and it can literally save your life, and if something is off, go to a medical professional and have it checked. I had intestinal cancer. Had no idea I had it. Everything else was in the healthy zone for an old, slightly overweight person. My family has turned cancer into a team sport, so I expected it to come at some point, but expected later. Based on my dad's generation's history, my whole family on my dad's side have had some form or another of cancer, usually getting sick in their mid to late 60s. We also respond well to treatment and get better, averaging another 10 to 15 years after. When I turned 50, did all the right things you're supposed to do, such as colonoscopy, blood tests, etc. None of them found any cancer flags. I was working out one day, felt sick, and thought it was because I hadn't eaten enough for my body to work off of while working out. Went up, laid down, and every couple hours, threw up. After about 12 hours, the wife said it wasn't right, sent me to the hospital. This was the beginning of the plaque, so she couldn't come in. X-ray, CT, ultrasound, CT again. 9 hours later was advised I was getting admitted for surgery the next day. They took out about 8 inches of small intestine, right below the stomach, with a fist-sized tumor. Only it was on the outside of the intestine, and it had squeezed it shut. It was sent for testing, it was cancerous, and there were still 3 small tumors. Chemo and radiation killed them. I'm currently cancer-free. Until that time I went to the hospital, no one had any idea I had cancer, I didn't have any issues, no pain, no fatigue, nothing. It was big enough that it had probably been there a couple years. The protein it exhibited in the bloodstream was not one of the more common ones, so the basic blood test screening didn't find it. An endoscopy only would have seen a closure of my intestine, but wouldn't have seen the cancer, as it was outside of the intestine. I currently advocate anyone that may be at risk of cancer, or has a family history like mine, get a PET scan regularly, say every 1 to 3 years, if you can push your doctor to refer it, because the PET operator basically told me that cancer cells large enough to, give off a glow in the scan. If there is only 1 or 2 cells, too small to find, you won't see them. That's why I say regularly, because what may not be found today, might be seen in a year or 2. Thank you for listening. Like and subscribe for more videos.